Good morning. I'm Dr. Sridhar K. Welcome to my channel. And today we will be discussing a very important topic for the parents of babies who are admitted in the neonatal unit. And actually what we discuss today will help any parent whose baby has any form of illness. So when they go through a period of hospitalization, what approach the parent should take. And we have with us one of the babies we had managed last year, and Khushboo Sanjania is a medical geneticist, and she has her own blog on Instagram. She has her own website, and I read through some of her blogs, very interesting, and I'm sure all of you would go through. I'll put the details in the about info below the introduction to this video as well. So thank you for taking the time, Khushboo. Nice to see you.
Thank you so much. Thank you for having me, Doctor.
So I know I read one of your blogs which guides us about the experience you faced as a parent, and you're giving tips to other parents on how to cope. And
Yes.
Thankfully, your baby was very small but had a relatively straightforward course. But even there, you face the stress as a parent. And most of what you say today will help any parent, and it's just cues on what to do. And in terms of NICU, neonatal intensive care stay, we have varying lengths. So we get extreme premature babies who are born like 23 weeks, and then they stay in the unit for about 3 to 4 months. Sometimes it takes even a few months more. So we have had babies getting discharged like 7 or 8 months down the line. So we have many babies who go through procedures while they're in the NICU. We have to discuss with the family, we have to take their consent. And there are uncertainties all along. I mean, even if you expect a straightforward course, even the slightest hiccup may cause anxiety in you. And communication becomes very important. The rapport you establish with the physician becomes very important. How you speak to each other as a family. I mean, spouse supporting each other and relaxing adequately, very important as well. And if you have an extended family, you have to make your mind as to how much you want to burden them with this. I mean, if it will really help you, you have to involve them. If it doesn't help you, you have to make the decision. So can you go through your experience and in about
Sure.
8 to 10 minutes, what you can guide us on?
Sure. So I'm a parent of 2 children. My first one was quite normal, but I wasn't expecting with my second child to for my baby boy to be admitted in the NICU. And even though I was a second-time mother, the whole experience was very new to me. This is why I wrote down a blog post to be able to help other parents who are going through the same process, or maybe relatives who could help other NICU parents. Some of the tips that I'd like to share. One of the reasons, firstly, I would like to say about why my son was admitted in NICU was because of his low birth weight. So I guess every child who is admitted in NICU is admitted for various reasons. Mine was fortunately straightforward. It was a weight-related issue, but I still felt very overwhelmed and very anxious about the whole process. Some of the ways that I coped during the 1 week long stay that my son was in NICU was through these tips. Number one, ask questions. Always be willing to ask questions to the NICU staff. They are some of the most kindest people on the earth. They can really relate to you, the feelings that you're going through, as a mom especially as well. I made sure that I timed my visits when the doctor was doing his morning rounds. That way I could get the information straight as he was doing the checkups with my baby. When the doctor wasn't around, I used to ask the nurses that were there, the staff that were there. I would ask them to show me how to dress my baby boy, because he was so tiny and I had to be very gentle with him. So even though I was a parent for the second time, I still had to relearn everything. I had to learn how to dress him, how to feed him. I always made sure that if I faced any issues with the latch during the breastfeeding, I would ask questions to the lactation consultant. And I was always asking questions about his weight gain, the growth curve, as much as information as I could get while I was there. I think that is very important, because once you are discharged from NICU, it's just you, your husband, and the baby. So I think it's very important to make use of the time while your baby is in the NICU to gather as much as information as you can. One of the other tips I'd like to share is to visit your baby as much as possible. It may seem like, your baby's in ICU and he's being taken care of, and you can, for example, relax. But I felt like I would visit my son at least 3 times in a day. I would encourage skin-to-skin contact as well. It not only benefited my baby, but also myself as well. As a mother who's just had normal delivery, I think it was very important for my body to feel as normal as possible, even though my child wasn't next to me. So that is one of another tips that I'd share. Something else I'd like to share is to ask the right questions to the right people. Do not read anything on Google. I know it's so easy right now to have your phone on you, just scroll through Google, scroll through Facebook groups. But you must remember that what is shared online is not always backed by medical, it's not backed by anyone written, who's medically written, or it could just be an experience or just an opinion. It doesn't mean that another experience could be the same experience that you have. So always ask the right questions to your physician, the one who's handling your baby, the one who knows exactly what your baby is facing, what he's going through. If there is any procedure that your baby needs to be going through. My son, for example, had to have his tongue tie. I think that's the right word, doctor. The tongue tie procedure done, and he had it done at day 4. I still remember me and my husband were very anxious about the whole thing as a 4-month-old baby going in for a procedure. But we asked the right questions to the right doctors. We asked you, and we also asked the surgeon, Dr. Salah, and he reassured us that everything's going to go fine and will only be beneficial for my son in the long term. So based on the correct information that we were provided, we made the decision to go ahead. And I made sure to completely switch off checking internet for all advices and all of that, because sometimes a lot of information can be very overwhelming. Apart from that, as a mother, I think it's very important to also make sure that you eat healthy, because the formula is quite simple. If you eat healthy, you produce good milk, and your baby gets all that milk, and the baby's going to grow and eventually, be graduating from NICU out. So I think it's very important to do that. I was very lucky that I had a very good family support system. My mom was over here, and she made sure that she would feed me all the healthy traditional homemade food. So I was being looked after in that sense. And my husband was also a very good, strong support system. Anytime I felt like I needed to go see my baby boy in the NICU, he was ready to take me. He was also ready to drop off any milk that I was expressing at home straight to the hospital, so that my baby boy would always be getting the milk. Even though he was being fed infant formula at the hospital, I made sure that I wanted to push myself to make the whole experience as normal as possible. So I was trying my best to express and provide the milk to him. And apart from that, it's very important to breathe, take a walk. Just remember that once your baby is home with you, it's just going to be you managing throughout the night, the difficult nights, the crazy mornings. So while the baby is in the safe hands of the NICU staff, who are very capable, who are very kind as well, try to take that time to do something for yourself as much as you can. It's very easier said than done, but try to have a cup of coffee with your friends. Try to just relax, read a book, just do something that helps you take your mind off this period, because I can understand it being very overwhelming and it being very anxious for some of them. Lastly, I'd just like to say that if you feel like you want to talk to other parents, please go ahead. While I was there in the week at the NICU, I didn't come across many parents, but I did find it useful to join a Facebook group where I just felt like because it's you could talk to people who have been through similar situations to get them to understand what you're going through is much more easier than sometimes talking to your own family members. So if you feel like you want to talk to other parents, or if you want to feel like you want to talk to the staff at the hospital, please go ahead and do so. Yeah, and lastly, just take care of yourself. Just get good rest, good sleep. Don't be too hard on yourself. Don't blame yourself for why your baby is in the NICU. It is not your fault. The fact that you're thinking about it, the fact that you're even worrying about it, it's showing that you're already being a very good parent. So yeah, and if there's anything, please seek help. That's all. Those are my tips.
I mean, you're very fluent. Well done. Great job. So I think you stressed on very important aspects. The first thing is the rapport with your physician or the team managing the baby is very important. As you rightly said, it's not one person managing it. Actually, the nurses by the bedside know a lot more about your baby, and the physician is guiding the team, but still speaking to everyone in the team. At the same time, I would stress that don't speak to too many people. Don't. There are parents who like to repeat the same question to different people, and they seem to get confused when slightly different versions of the answer come. So, what I tell my team is to update the parents in terms of regular progress, like weight gain, how the baby is sucking, how the progress is. If there are any immediate changes made, they would be updated. But as far as we have a vision plan for the future course of the baby, what will be the next treatment if any major procedure is to be done, so that at the senior level we tend to do it ourselves, so we don't have different versions. And I would suggest to parents that they don't test the waters with different people. I mean, I know
Definitely. I think I just when it comes to medical information, please just stick to the experts, so the medical team at the hospital. But yeah, if you need like a personal support, if you just need a shoulder to cry on, I think sometimes NICU parents can relate more than your own family. That's what I felt.
Absolutely.
But,
And in terms
if
of
it's to do with anything medical, please just stick to the professionals.
Yeah, and in terms of searching out knowledge, I mean, Googling for information is here to stay. I mean, even though we discourage people to do it, but when you do find information on Google, you have to look at the source of the, I mean, whether it is a medical source, whether it is an authorized source, and so on. I mean, if it is someone you trust, I mean, that is one of the reasons I've started this channel in the first place, to have one place where you can get the information to a reasonable extent, and you also know that based on the qualifications or based on the details that are there, you know that it is someone reliable from that same field. Similar sources would be there. I'm sure there are other sources, and I'm just trying to collect the information to be in one place, so to help the parents. In terms of emotional coping, you rightly pointed out, I mean, the postpartum period is a very stressful period for the mothers, and I know the obstetricians might touch on that topic of postpartum depression or postnatal depression. So, I mean, you're going through a lot of hormonal changes, which puts you at high risk, and that's where I stress on the spouse supporting you. I mean, you are already losing your sleep from anxiety, from having to wake up regularly to express milk, the emotional void of not having the baby with you when you need to have. So it's stressful enough, and on top of that, your hormonal changes makes it more difficult. So here I would request all the parents to involve, I mean, the husbands to be caring for their wives, to understand the stress they are going through, and it's not easy, and support them through that. And obviously, if you have a big family and people may have different opinions on how to proceed with things, again, you have to be clear cut about what role you give them to control the process. So I mean, if there are decisions to be made, you mentioned the tongue tie, for example. We have seen many extended families trying to interfere. Again, do it or don't do it. They may be well-wishers, there is no doubt about it. But when we have something to be done, it's better the parents stick with themselves and the physician to make the decision. So involving too many people, it's the same story of too many cooks spoil the broth. So you have to be clear about who has to be involved in the care. So I think you have anything else to add, Khushboo?
No, I think we've covered everything. But yeah, I can understand as an NICU parent, when you're going through that phase, it can feel really difficult and hard. But trust me, when you've passed it, you've gone through that difficult stage, you'll feel really proud. Right now, I'm almost going to be celebrating my son's first year birthday next month, and I can't believe that we've done it. And yes, thanks to you as well, doctor. We've kept that relationship, that professional relationship, strong. So I've always felt very comfortable speaking about the changes as milestones, everything with you. And yeah, thank you for this.
Thank you, and congratulations on his approaching birthday. That's a
Yes.
proud moment for everyone.
Yay!
That's good. I mean, I'm sure we'll look for more updates on your blog as well. So thank you for your time. And I mean, one thing before we conclude, I would like to say that when you are having a sick baby in the unit, there are multiple physicians. You mentioned the surgeon. Sometimes we have the ophthalmologist treating the eyes of small babies. We have the radiologist coming in to do procedures. So communication skills and communication styles are different between different physicians. So once you have established a rapport with your main physician, I mean, feel comfortable to discuss those issues related. I mean, in case you couldn't ask certain information from the specialist, you can use the MRP as a conduit as well. So please make use of that opportunity, because you have better understanding and rapport from the beginning. And the doctors who come and do one test may not have the same rapport with you. They will give you the information needed to treat, but you may want more information. And if the MRP or the responsible physician doesn't have that information, he can always seek out as a colleague from the other treating physician as well. So thank you so much, Khushboo. And that was a great session. And I'm sure many parents would appreciate the contribution you have made. I'm sure all of you can get in touch with Khushboo as well if you have any queries, either through this comment section or directly through her Instagram page. And congratulations on the work you're doing as well. With this, I think we'll close this. And my aim through this channel is to provide a source of reliable information to families. There is no link to whether they are my patients or anybody else's patient, whether they are in Dubai, whether they are in India or UK or anywhere in the world. So please don't hesitate to share this information, and there's absolutely no obligation. And thank you. I hope this helps, and do subscribe and share. Thank you.
Thank you.